Patients will sometimes come to my clinic asking for all sorts of things, and rightly so. They want to have the best possible outcome from their surgery, and they've done their research, they see things on social media. But it is important to understand there are always limitations to what can be achieved from surgery. Typically, and I often talk about this in my videos, is the thickness of the skin type. When patients have particularly thick skin, it's very difficult to give them a completely smaller looking nose. And often, if we take away too much cartilage or take away the framework of the nose, it can actually make the nose sort of slightly counterintuitively look somewhat bigger. So when we do talk about what sort of changes are possible, I think it's important to just perhaps understand that there are limitations to what can be achieved. Each rhinoplasty has to be tailored for the individual. We can make the nose slimmer, we can sometimes make it longer, we can rotate the nose, so give it more of a lift. In some cases, if it's too over-rotated, typically after previous surgery, we can de-rotate the nose, so make the nose droop somewhat. We can lengthen, we can shorten the nose, we can reduce a dorsal hump, we can even augment in some cases when they don't have much of a hump. For example, after a previous injury or previous surgery, they may have a saddle nose deformity. There's all sorts of changes that we can make, but that's a very personalized conversation to have with your surgeon.